Well, the STEPAUT study was a non-interventional study, a nationwide study in Austria, where patients receiving everolimus plus exemestane were collected, and data were collected in order to have a real-world signal of, how is the tolerability, how is the efficacy outside those pivotal studies. I had the privilege to work on the Bolero-2 trial, which was basically the breakthrough trial for mTOR inhibition and defining the position of everolimus in the sequence of therapies in metastatic breast cancer. However, this class of drugs is not easy to manage. It's not chemotherapy. It's an endocrine or more targeted plus endocrine intervention. But there are side effects that physicians need to learn about. At the time when that started, this was unusual. Like managing a rash is not something that breast cancer oncologists were used to. It may have been different in people using EGFR receptors more often, but they are not used in the disease. So we set out to collect as many patients as possible within one nation. It was a great collaboration of centers countrywide, and eventually almost 250 patients were enrolled at 17 sites, and the main result was that the median progression-free survival in the routine practice setting was 9.5 months, which is very comparable to that of the randomized clinical trials. Sometimes in clinical research, we observe that these most important but also highly developed trials show better results than we are able to achieve in the whole broadness of routine clinical practice. And the reason for this is that certainly in clinical trials you have very selected centers. There's a huge amount of quality control mechanisms built into these trials, and it sometimes does not really reflect what happens in everyday care. So I think it is of value to have these such real-world data collections in order to confirm that what we as clinical researchers, as academics develop in terms of innovation, what of that arrives at patients in routine clinical practice. In terms of side effects, the expected side effects were observed. However, they were mild in the majority of patients and moderate in most of the remaining patients. So around 55% had only mild side effects, and little over 1/3, which together is more than 90%, had moderate adverse effects. And the most common adverse effects were stomatitis, mucositis, which tortured approximately half of all patients, and some exanthema, loss of appetite. So that's very well in line with the known and scientifically defined tolerability profile of the drug. But it was also interesting to see that this real-world experience is very consistent with results from the pivotal registration studies, in this case Bolero-2, which, by the way, was also presented at an ESMO meeting several years ago. So I think in summary, this observation, and there were some other aspects like dose reduction and treatment breaks, and all of this was very well within the expected, and I think this is reassuring, that we could see in this cohort of patients in 17 centers countrywide, not all of them university centers, some of them in the countryside, that the data we achieve in the pivotal studies are reliable and do in fact reflect what our patients in routine clinical practice can expect, both in terms of the efficacy as well as in terms of tolerability issues.